We need 2.1 million nurses in 2025. Did you know that? Is that shocking or something that you know is going to happen? Especially the locums market of needing travel nurses has been booming, and our nurse shortage has not been fulfilling seamlessly at all. Discover today on how one nurse was able to create a system starting from helping one student to be able to connect with multiple universities, creating more than 10 million in revenue on creating educational platforms to boost and improve the nurses' education system.
Welcome to Provider's Edge, the podcast that helps healthcare entrepreneurs and innovators break down barriers and control their business, life, and future with valuable action steps. With me, your host, Sabrina Runbeck, a recovered clinician and a business deal catalyst. Let's rewrite the rules and create a positive social impact while increasing your profitability. All right, everyone, we have Morgan Taylor here with us. She is a pediatric nurse practitioner and nurse educator known for her simplifying complex topics, organizing curriculum flows, and bringing joy into learning. And as Chief Nursing Officer, Morgan leads the design of comprehensive way to include intensive care, emergency medicine at Duke University, as well as Seattle Children's and Boston Children's Hospital. Additional experience including founding Make a Change, a nonprofit dedicated to provide diapers to low-income families, and working in Guatemala, and really a global collective of vital event data to reduce maternal mortality rates. And Morgan holds a doctorate in nurse practitioner from the University of Tennessee and a Bachelor of Nursing and BA in Spanish language from the University of North Carolina. She lives in Apex, North Carolina. Her husband and her two dogs all enjoy her, and also some good murder mysteries.
Thank you, Sabrina. It's great to be here. I'm looking forward to our conversation.
Yeah, I always feel like everyone's being on our show also have a interesting background. And now as our audience are also leaders who step up, whether they volunteered or volunteered their positions, and then they start creating something amazing and change. And I feel like we are all doing something different in healthcare and all technically for the same goal, whether you're in academic areas like yourself or the clinical practice or the innovation side, or even patient and care management side, right? And everything kind of just all tap into each other. So for you, at what point did you start to feel like, hey, there's something more that I wanted to do, and specifically in the pediatric domain, and start thinking now shifting into, you know what, education is something that I found is most lacking?
Yeah, absolutely. I always say I kind of fell into this. It was never some grand plan for me to go into education. And for me, it was really born at the intercept of education and transition to practice in that new graduate nurse who is just entering practice at the bedside. I was working at Duke University Hospital for most of my career in pediatrics, and worked there throughout the pandemic, 2020 into 2021, and really firsthand noticed how new nurses coming into practice at this time were very unsupported, for lack of a better word. To no one's particular fault, they were coming into a profession that was in just absolute chaos, dealing with one of the most challenging times we have ever personally seen. but they truly just did not have the resources that they required to take care of very, very sick patients. And as I started to dig deeper into this and look at the root cause of why are these nurses unprepared and feeling not supported, it went a lot deeper than just the chaos of the pandemic. It spoke to the lack of resources that faculty have, the decreasing number of faculty that we have to raise a new generation of nurses that needs to be bigger and stronger than ever. So I knew that just being one preceptor at the bedside, as much as I love that, it would only be so impactful. I could only touch one new nurse at a time. So I started looking for opportunities more upstream in how to impact education for the student, for the faculties, and make it supportive, joyful, and impactful so that as these students transitioned to practice, they would already love nursing. They would want to be here for the long haul and have the resources that they needed to grow into thriving professionals.
I think that lack of staffing is across the board, right? We are lacking staffing in clinical medicine. We're lacking in education. And even I had a little bit of experience into when I was full-time clinical practice, being one of the lead for department CMEs and for the active practice. But we also know, like what you mentioned, when that transitional time, when there's a pandemic or there's natural disaster, the way that we learn completely changes than what we used to be. And sometimes even for people who are trained coming out, we were trained much more rigorously than the students are doing right now, right? And we all have the tendency of like, no, we love to show you. Yeah, we like to be preceptor, but we're only with one or a few students at a time. The impact is really whoever coming into our door instead of how do you do it in a larger scale, right? Helping the gaps of people are not able to assess it. And then you guys start creating the technology, the training platform, really fill those gaps. So how did it really come all together, right? Because we all know when you have a big dream, sometimes it can feels like climbing mountains before it takes off, right? So at what point you felt like, oh my God, I did this thing and this really helped us to push forward?
Absolutely. And like you said, we not only need to create platforms that, our students can utilize to get that education they're lacking, we need to be innovative in the way we do that so that we're most efficiently using any resource out there and creating new resources that will be more effective for larger numbers of students. One of the primary drivers of the problem, in my opinion, is the decreasing number of faculty that we have to properly educate and support the growing number of students. I mean, we're all just human. We can only do so much, and we're being asked to do more and more with less and less, and it's to the students' detriment. So we have to get creative, right? We have to come up with new ways to engage students and make sure that they really get the support that they need.
What captivated me about Morgan's journey was that her experience during the pandemic really illuminated a critical gap in healthcare education system. Seeing new nurses entering this field without proper support really sparked her interest of how do we make things better? Just like many of you out there who are innovators, creators, and clinicians alike who thought about, hey, this is the way that we do it, but it's really not the best way. How do I make it better? As a pediatric nurse practitioner who has worked at prestigious institutions such as the Duke University and Boston Children's Hospital, she recognized that one-on-one mentorship, while valuable, couldn't meet the growth demand of our entire healthcare system. talking about those 2 million needs of nurses across the board, even just in this country alone. And her response is to build something that's more innovative and very specifically focused on helping nurses to pass their board exam, focused on the NCLEX, to support the comprehensive ecosystem, and showcasing how healthcare leaders can scale impact while maintaining the human touch, which is so essential when we're talking about innovation and technology behind everything that we're doing in healthcare, which are centered with people. Centers should always be patient. And how do we create that empowered ecosystem around it? And now, Morgan has been able to do that. How are you able to do the same to empower the people in the center of everything, not just the technology, in your everyday conversation of getting support, whether from investors as well as from your business partners or that big contract that you need to close? Now, if you believe you have an amazing story to share and then you have to be out there truly not be a best kept secret, we have many different shows between the Provider's Edge as well as our game show, Health Tech Showdown, that truly can help you to spotlight and not only demonstrate your authority in the space, but also help you close more deals and gaining more funding. If you're interested, go to healthtechshowdown.com to apply. All right, let's continue the rest of our conversation with Morgan.
So all that being said, I think for me, we started out in the board preparation space, getting nurses ready to take their NCLEX, their exam for licensure, and expanded from there. And we started simple. We started with a question bank. We grew to videos and then live webinars and kind of spiderwebbed out from there. Really, for us, the key tenet was keeping our ear to the ground and listening for what students wanted. If you're willing to listen, they will tell you what they are looking for. They will tell you how they learn best and what makes them feel best. And that is what we do to this day. We listen to our students and continue to improve our product so that it meets their growing and changing needs. I mean, every day it's something a little bit different. So I think the moment in time where I started looking back saying, yeah, we've got something here, we're starting to make an impact, was the first time a student told me, Morgan, I could hear your voice in my head while I was taking my exam. I knew I had the answers. I was so excited. And I realized that by creating these video series, by doing these free webinars, even though I couldn't see the student one-on-one, I was holding their hand throughout these exams and giving them the support that I knew they were lacking, that I knew I craved during my nursing education. And if I can do that for just a handful of students, I know we have met our goal.
What I'm hearing is you started from one step at a time and then you start getting traction. Is that sometimes we all been there. It's not just feel like I have this big goal. Let's eat an elephant like in a day, right? It's that you start running webinars. You start creating education contents as people using it more and more, and also be very intentional to focus on one thing, right? First is prepare for exam. And then you guys start expanding into ongoing educational part to fill the gap. So I think all of us have to keep that in mind is what is the perhaps highly convertible resources that you need to give to the people that want it. And you start changing or adapting to the user base for them to actually want to use it, right? We can't create things that people cannot access or adapt to it. Then no matter how perfect we create it, it's actually not that useful, right? So you're listening to the people. So that also means you are great at thinking about client retention and thinking about getting people and meeting them where they are. Right. And I think that's a huge thing when it comes to developing the product that fits a market need.
and then changing. And as you guys grow, clearly you start expanding the team, right? And now you have some co-founders, you have board member. How did you start finding the right people to get you where you need to go?
Yeah, great question. You're so right that I believe one of the key reasons we've been successful is our willingness to adapt. If something's not working, we're very willing to kill it and move on. And if something is working, then we're going to dig into why is that working and how do we capitalize on it? And again, that all goes back to our students. They are the reason that we're successful. They're why I wake up and do what I do. So if someone has an idea for me, I am always going to listen to it and be willing to adapt when appropriate. So really looking at how we found the right people to scale to where we are now, it came out of need. You know, me and my CEO, Karthik, our lead technology, Gautam, we were really hustling, bootstrapping this, like listening to our students and just making improvements here and there. And it was when I started offering private tutoring for students. I started meeting with them one-on-one. I had so many students reach out. Oh, I failed my NCLEX, or I don't know what to do for my final exam in nursing school. And I said, I'll meet with you for 30 minutes. Let me do a little more personal one-on-one session. And my goodness, they were so rewarding. It was amazing to work one-on-one with students. And the demand far outpaced what myself could ever potentially offer. So really from that core need, I saw that, the students need this. We have got to find some other instructors. And that was who we started bringing on first, were instructors. The main thing we looked for was, what are your values? Why do you want to show up and do this? And what would this look like in 5 and 10 years if you were successful? And we brought on board people that shared our mission, vision, and values. For people who were like, I just want a little side gig to make some money. Money's important. I'm right there with you. I want to feed my family, but it is not why we are showing up. The people who we brought on were the people who said, I had test anxiety during nursing school. I learned to overcome it. And I want to share that with the next generation of nurses. Every single contractor, full-time employee, advisor that we've brought on shares that vision. And that has really created this beautiful circle of trust within our organization, because we all know why we are showing up and we trust each other to show up. And I believe full through and through that is why we have scaled to where we are and why we will continue to scale.
That's such a great point, because many founders will talk to me, Sabrina, we are all in need, right? And then sometimes we feel the need to say, I need a body to do this task, right? And then sometimes we can say, I'm not good at finance. Let me just grab a CFO just to do it. And then they rock the boat. And I'm like, oh my God, now you're coming back to me. And now we're talking about alignment and culture. This should have been done before. And now you have to fire someone 2 months later and we have to start the process all over again, right? And so it is, so even for us, when we are looking at executive teams and also how you trickle down, number one thing is that alignment. Is that subconsciously, who are you meant to be on this earth? How is that alignment truly matching the companies that you like to support and their goals, right? Because at the end of the day, we can't train people to be motivated. They have to have that inner motivation. And it's important from the top level as well as your managers and then the actual implementation team, right? And then
I completely agree. It really flows through top to bottom and bottom to top in both directions. And I think when our frontline staff feels that support because they know they're trusted, it reverberates and they trust us. When you have that bi-directional level of understanding and trust, you can accomplish so much more. It's overwhelming.
Exactly. And then when we're thinking about culture is actually influence and perception.
That students could hear her voice during their exam is perfectly captures how technology can really enhance rather than replace human elements in healthcare education. On top of that, it's not just healthcare education, it's everything that we're doing. It's how do we leverage technology to improve our workflow, reduce the amount of burnout that we're seeing or lack of education while we're becoming better providers or caregivers for the entire patient journey. Now, Morgan's focus has been niched down on creating supportive and innovative educational resources that truly helps nursing students to succeed by passing the board exam. Her approach is all about listening to the student themselves. And if we're creating innovations or solutions without talking to the end users, guess what? That's why adoption is very difficult and why people are not buying into what you are trying to solve, despite how impactful it is. I would love to hear from you guys. What have you been creating and solving? Comment below wherever you're listening and watching this episode right now. And if you haven't subscribed to our channel yet, please hit on the bell or hit subscribe. Love to connect with you further and to continue this conversation, because the more that we are engaging on top of these type of conversation, now we can truly spread the word and get the right people to buy into the ideas that you have in the most concise and impactful way, where people not just, hey, this is interesting, good luck to you, but wow, I need to be involved. I need to be able to help you. And that's how you can close more deals and get more investments and fundings to continue the amazing, innovative journey that you have been building in the healthcare space.
Do you actually understand everybody else's way of how they perceive a question being asked? Is that really challenging them, or simply understanding, or they're not really trying to offend you, right? And then or perhaps as them supporting you guys as a leader is that, Morgan loves people. It's really about who they are driving behind. So that also means for you, perhaps the decision-making part is what's the end result relate to all the people that we support, and not so much on all the things you have to do, because then people get lost in the doing the process part, right?
They do. And that's so easy to happen. It really is, because there's so much that has to happen day to day to just keep the train on the track. But if we focus on that minutia and the bigger why gets lost, I find that the team is far less effective. And then the day-to-day doesn't get done anyways. Exactly. I really firmly believe when you focus on that bigger picture, why are we doing this? Where will we be in 5 years? The day-to-day takes care of itself. Yes, you need to have good project management plans and clear directions and schedules, but that will come when everybody is committed to the same goal for the same reason.
For sure. And now that also brings up a great point. So if I'm going to give you a magic wand, and the magic wand going to grant you 3 big wishes, what do you use the magic wand for?
Oh man, I wasn't prepared for that. That's a fun question, Sabrina. A magic wand. So I think the first thing I would wish for is to inspire more students to go into education. Maybe not right at first, but to plant the seed that being an educator can be so rewarding and will really pay tenfold down the road, because we need more faculty to sustainably educate this group of hopefully growing nurses to care for our growing population, right? So wish number 1, more nursing educators. I think secondly, I would wish for a kinder approach to healthcare education, not just in nursing. In nursing, we have this horrible old saying, nurses eat their young. I firmly do not believe that that is the way to raise a compassionate group of individuals that will want to stay in the profession. And I know that that can be said of my medical colleagues, my nurse practitioner and physician assistants. I've heard many stories supporting that. So wish number 2, a kinder approach and a more supportive approach across the board. And then wish number 3, I would wish for more of our educational institutions to really look at supporting their students' test preparation and board preparation from day one. I think too often it is, oh my gosh, we're in our last semester. How do we make sure we get these pass rates through the roof? How do we make sure our students are ready? And we can really do them a disservice by not thinking about that preparation from day one. So planting the seed that those educational institutions, they're big, they're powerful, they have a lot of say, and they can influence the students' ability to be successful by thinking further ahead.
Oh, amazing, right? It's about pushing forward the tie and then not just saying, hey, we got our degree. This is the thing we meant to do. There's a lot bigger picture that we can all get involved in to think in a, not to say a novel way, but it's just how can you be able to participate in all different capacity that you can as an individual, and then think, yes, a lot of things we talk about is think with the end in mind, right? And then, but that also means from day one, what can we do to set these students up for success? And that's not just in nursing, really is across the board for all, and preparation, not just, oh, we're taking a quiz and that's that, is how do we think about test taking skills, not getting so worried and stressed out, and then you forget all the amazing knowledge that's actually in your head. We're not looking for the keywords that can, it's already showing the right answer, right? And then sometimes it's just a test taking skill. So now we all have a great community, right? We love to support. And then the biggest resource is we like to think that we have the best board of every single skill set. So if you think about our audience as that amazing board advisor for you at every single business sector, what would be one question you wanted to get answer to as you guys are in this expansion phase of being able to create even more better nurses out there? What would be the one question?
Oh, that's amazing. I know it right away. If anyone has the magic answer to this, please email me. My biggest question right now is how we grow our team, but remain committed to those core values and remain a close-knit group of coworkers. You know, right now we all know each other. We're all very passionate about what we're doing. And I do fear that we grow too big too fast and we lose that, right? Not everybody knows everybody anymore because you can only know so many people. And I do struggle with that give and take and wondering how big is too big and are we growing for the right reasons? I think that there's a bit of a balancing act in the years to come with our ability to scale, but our responsibility to do so responsibly.
Amazing. I think that is some scaling question, right? Because as people grow, let's say your core 10, and then once you hit that 50, and then once you hit 100, and then once you hit the multiple hundreds, there's a level of hierarchy or unfamiliarity as you span. And as a leader, and especially someone you are so passionate about, the individuals that you work with can sometimes feel that disconnect of, oh, I don't really know all of them. I know the concept. I know what we asked for the hiring question. We know they're at least here for the right reason, but how do they keep going in the same mindset as the company start to expand? So great questions. I'm sure the community will be able to feed you some of their thoughts as well. And then, of course, all of us will wish you a great success. And I can't wait to see all the other amazing things that you guys are able to do in the community, especially you already have so many contracts with universities as well as colleges within the nursing sphere. And can't wait to talk to you more about it.
Oh, wonderful. And same to you. I thank you again for the very insightful conversation, and I look forward to many more.
All right, so me and Morgan talked about a lot of amazing things today. Number one, how to identify a system gap in healthcare education, leading to a scalable business with just herself and a co-founder and a few board members. They're able to grow the business for more than $10 million in revenue while working part-time. And that's amazing. And number two is the importance of solving one problem at a given time before expanding to other applications. I think many of you have amazing solutions that can be perhaps a value-based care, could be for employers, could be clinician groups, or could be individual patients. Now, you cannot boil the ocean, doing one thing really well at a time before you start going to the next phase. Number three is why student feedback, hearing directly from your buyer, is so important while you're building this solution so they can actually see the value of what you're doing. And number four is the role of human. Number four, the role of value-based hiring in scaling a company. We all know human capital is super important in this field. How are you doing that? How are you making sure that the people that you hire not only have the skill set that you have, but also the same purpose alignment, the same energy, the same communication style that fits the rest of the team? And honoring the individuality of those people, but also giving them the right support, resources, and put them in the right seat so they can help you continue to build your company. And we also talked about the biggest pitfall to avoid when growing a education tech startup, as well as strategies for sustainability. And we all know entrepreneurship is a big roller coaster. So sustainability means continuously adding, growing, double, tripling your revenue, your patient load, your impact, your team on every single aspect. It's hard. And many times we've seen startups having 2 contracts coming in, losing one, having a big contract that's millions of patients, but stalling in actually getting going. And months later, they're still having meetings, but not closing the deal. So how do you truly do it sustainably? With Megan's success truly isn't just about having a grand master plan. She starts small, focused on one single problem, which is exam preparation. And she lets student feedback to get her growth, which means client retention. And when you optimize the solution, not so much about, let me just put more money into building up my technology platform, is something that's minimum viable product that your client already tested and give you direct feedback to change to match their need. Then you put more money and energy into it. That's how you build something that actually works, that people actually want, not just what you believe what they want. And as to her success in scaling her company, and the number one thing she's shared is finding people who truly share the same mission as her, the people who want to donate their time and energy into improving nursing education. And that means when you're hiring, you do need to take a little bit more time to find those right people and not just place a body, do the task, but then quickly you have to replace them. And that's what she said, creating a beautiful circle of trust. Now, I would love to ask you, how are you creating something that's more sustainable, especially know how to bring on the right support system, the right staff member to help you grow? Comment below. Let us hear from you as you standing out and continue to be an amazing leader in healthcare.
Thank you for tuning in to Provider's Edge podcast. We hope you enjoy our latest episode and found the insights and tips helpful. We'd love to hear your feedback on the show and learn what topics you'd like us to cover in the future. So please take a moment to leave us a review on your favorite podcast platform and let us know what you think. Your feedback is essential to help us improve the show and provide you with the content you need to take your healthcare business to the next level. Thank you for your support, and we look forward to hearing from you soon.